This diastolic rumbling murmur is typical for mitral stenosis. Notice the increased S1 and loud opening snap that accompany this murmur. In mitral stenosis, the A2 to opening snap interval is related to the severity of obstruction. Patients with severe mitral stenosis often have an A2 to opening snap interval of 80 milliseconds or less. The murmur of mitral stenosis is low-pitched and requires the bell of the stethoscope to be held lightly on the chest wall. Newer electronic stethoscopes make this murmur easier to hear. The murmur of mitral stenosis becomes louder with maneuvers that increase heart rate. An easy way to produce this effect at the bedside is to have the patient perform a few sit-ups. Note the change in this murmur as the heart rate increases. At heart rates above 85 beats per minute, systole and diastole may become equal in duration, and a diastolic murmur like mitral stenosis can be mistaken for a systolic one. Listen to the murmur of mitral stenosis at a heart rate of 85 and notice how easy it is to mistake this for a systolic murmur. I will begin with normal heart sounds and then add the opening snap and then the murmur. Mitral stenosis and mitral regurgitation sometimes occur together, and it can be challenging to detect the diastolic murmur in this setting. Listen to the combined murmurs of mitral stenosis and mitral regurgitation. I will start with S1 and S2, add the opening snap, then the murmur of mitral stenosis, and finally the murmur of mitral regurgitation. With the advent of three-dimensional echocardiography, new details on mitral valve pathology are becoming available. This image shows mitral stenosis from the view of the left atrium. Percutaneous balloon valvuloplasty is an effective treatment for patients with mitral stenosis who have appropriate findings. These findings include commissural fusion of non-calcified pliable leaflets with no atrial thrombus nor significant mitral regurgitation. Listen once again to combine mitral stenosis and regurgitation. In calcific mitral stenosis, both the opening snap and loud first heart sound can be lost due to leaflet immobility, but the murmur remains. Echo Doppler cardiography remains the best diagnostic test to detect and quantify mitral stenosis. In summary, mitral stenosis, although decreasing in developed countries, remains a continuing challenge in much of the world. Diagnostic and therapeutic advances for patients with this disease have led to successful interventions by cardiologists. Listen once again to combine mitral stenosis and regurgitation. This pansystolic murmur is classic for mitral regurgitation. One feature that distinguishes regurgitant murmurs from ejection ones is that they tend to go all the way to the second heart sound. Listen once again to mitral regurgitation. A third heart sound may occur with mitral regurgitation and can be a sign of a large regurgitant volume or left ventricular dysfunction. I will start with normal heart sounds and then add the third heart sound and then the murmur. When mitral regurgitation is due to mitral valve prolapse, the murmur may be crescendo in character, beginning in mid-systole and increasing to the second heart sound. The murmur of mitral valve prolapse decreases with squatting. Listen to the change of this murmur with a squat maneuver. Standing. Squatting. Another variant of mitral regurgitation is the decrescendo murmur of acute mitral regurgitation. As the pressures in the left atrium and ventricle equalize towards the end of systole, the intensity of this murmur decreases. A common cause of mitral regurgitation is myxomatous degeneration of the mitral valve, as shown here. This disease can result in rupture of a chordae tendineae with acute mitral regurgitation. With the rupture of a chordae tendineae, there may be a third heart sound and a fourth heart sound, as well as a murmur. I will begin with normal heart sounds and then add the third sound, then the fourth, and finally the murmur. Patients with acute mitral regurgitation can present with severe heart failure and may need stabilization with intra-aortic balloon counterpulsation prior to emergent surgery. Recently, percutaneous mitral valve repair has become available for patients with suitable anatomy. Listen once again to a patient with both a third and a fourth heart sound and mitral regurgitation. In summary, mitral regurgitation may have different shapes depending on its etiology. On occasion, a third and a fourth heart sound may accompany mitral regurgitation.